Question 1. In the context of producing positron-emitting radionuclides for PET imaging, Octocera is working in a cyclotron facility. She needs to produce a radionuclide with a half-life of 110 minutes for an upcoming clinical scan. Which of the following radionuclides should Octocera select based on its suitable half-life for PET imaging? A. 11C, B. 15O, C. 68, G, D. 18F. Answer. Correct answer A. 11C. Explanation. In PET imaging, radionuclides with suitable half-lives for effective imaging are crucial. For instance, 11C has a half-life of approximately 20.4 minutes, which is ideal for short scans. However, among the given options, 11C's half-life makes it particularly advantageous when imaging requires short-duration tracer uptake, such as in dynamic studies. The other options, 15, 68 G, and 18F, have significantly different half-lives, affecting their clinical use. Question 2. Considering the principles of radiochemistry, Dr. Johnson is tasked with synthesizing a PET radiopharmaceutical for a clinical trial. Which of the following chemical reactions would most likely be involved in the synthesis of a radiolabeled tracer like 18-EDG fluorodeoxyglucose? A. Nucleophilic substitution of a halogen with a fluorine atom. B. Proton bombardment of a stable element to produce a positron emitter. C. Decay of a radionuclide followed by positron emission. D. Hydrolysis of a radioactive ester group to yield a free compound. Answer. Correct answer A. Nucleophilic substitution of a halogen with a fluorine atom. Explanation. The synthesis UL18-FFG involves a nucleophilic substitution reaction in which a fluoride ion 18F replaces a halogen such as chlorine in the precursor molecule. This process, known as a nucleophilic fluorination, is essential for incorporating the radioactive fluorine into the glucose molecule. Proton bombardment or processes are more related to radionuclide production, not the radiochemical synthesis step. Question 3. During a PET scan, the radiation from the positron annihilation event is detected. How does the coincidence detection process help in the reconstruction of the image? A. It ensures only high-energy photons are detected. B. It helps in identifying the exact location of the annihilation event by measuring the time difference between two photons. C. It distinguishes between scattered and non-scattered photons. D. It reduces the number of false positives during imaging. Answer. Correct answer B. It helps in identifying the exact location of the annihilation event by measuring the time difference between two photons. Explanation. Coincidence detection in PET is based on detecting pairs of photons emitted during the annihilation process where a positron collides with an electron. These two photons travel in opposite directions and are detected simultaneously by the detectors. By analyzing the time difference between these photons, the system can determine the location along the line of response law where the annihilation occurred. This is fundamental for accurate image reconstruction in PET scans. Question 4. Based on the information available regarding attenuation correction in PET imaging, why is it important to apply this correction to the acquired data? A. To improve the signal-to-noise ratio in the reconstructed image. B. To compensate for the loss of photons as they pass through tissues of varying densities. C. To correct for patient motion during the scan. D. To enhance the spatial resolution of the PET scanner. Answer. Correct answer B. To compensate for the loss of photons as they pass through tissues of varying densities. Explanation. Attenuation correction is essential in PET to account for the absorption or scattering of photons as they pass through different tissues in the body. Dense tissues such as bones absorb or scatter more photons than less dense tissues, leading to an accurate quantification of tracer uptake. Attenuation correction algorithms help to adjust for this loss photons, ensuring that the reconstructed image accurately reflects the tracer's distribution in the body. Question 5. Considering PET scanner components, Octolora is examining the performance of the photomultiplier tubes PMTS in the scanner. Which of the following describes the primary function of PMTS in the PET scanner system? A. To convert positron emissions into measurable radiation. B. To detect light emitted from scintillation crystals and amplify it. C. To focus the photon stream for better spatial resolution. D. To perform the image reconstruction process from the detected signals. Answer. Correct answer. B. To detect light emitted from scintillation crystals and amplify it. Explanation. Photomultiplier tubes PMTS are a crucial component in the PET scanner's detection system. They detect the light emitted by scintillation crystals when they interact with gamma photons. The PMTS then amplify this light signal and convert it into an electrical signal that is processed to generate the PET image. The other options refer to func that either involve other components or processes outside of the PMT's role. Question 6. In the case of hybrid PET systems, Dr. Michael is analyzing a patient's scan. Which of the following best explains the advantage of using hybrid PET scanner over standalone PET scanner? A. The CT component improves the spatial resolution of the PET images. B. The PET component provides more detailed anatomical information compared to CT. C. The CT scan provides attenuation correction for the PET data, improving quantification accuracy. D. The PET component is used to diagnose bone fractures, which the CT cannot do. Answer. Correct answer. C. The CT scan provides attenuation correction for the PET data, improving quantification accuracy. Explanation. In hybrid PET systems, the CT scan is used primarily for attenuation correction, which is essential for accurate PET imaging. The CT scan provides high-resolution anatomical data that allows for the correction of photon loss in different tissue densities, improving the accuracy and reliability of the PET scan. The PET provides functional data. The CT enhances anatomical localization, but the primary advantage is attenuation correction. Question 7. Which of the following best describes the role of time-of-flight (TOF) technology in PET imaging? A. TOF allows for more accurate energy measurement of detected photons. B. TOF increases the system's spatial resolution by narrowing the detector's field of view. C. TOF improves the localization of the annihilation event by using the time difference between detected photons. D. TOF reduces the radiation dose to the patient during the scan. Answer. Correct answer. C. TOF improves the localization of the annihilation event by using the time difference between detected photons. Explanation. Time-of-flight (TOF) technology in PET works by measuring the time difference between the detection of the two annihilation photons. This time difference allows for more precise localization of the annihilation event along the line of response law, which improves image quality and reduces noise. TOF does not impact radiation dose or energy measurement, and while it can contribute to improved resolution, its primary function is in better event localization. Question 8. Given the circumstances, Dr. Emma is using a PET scan to monitor a cancer patient's response to treatment. Which of the following quantitative metrics should Dr. Emma use to assess the metabolic activity of the tumor? A. Standardized uptake value (SUV). B. Image resolution. C. Patient motion artifacts. D. Tumor size on CT images. Answer. Correct answer. A. Standardized uptake value (SUV). Explanation. The standardized uptake value (SUV) is a key quantitative metric in PET imaging used to assess the metabolic activity of tissues such as tumors. It is calculated by normalizing the radiotracer uptake to account for variations in patient weight and scanner performance. SUV helps in assessing treatment response, as a decrease in SUV often indicates a reduction in tumor metabolic activity following effective treatment. Tumor size and image resolution are also important but do not directly measure metabolic activity. Question 9. From the perspective of PET imaging and brain research, Dr. Jack is studying a patient with suspected Alzheimer's disease. Which of the following PET tracers would be most appropriate for evaluating amyloid plaque deposition in the brain? A. 18F-FDG. B. 11-CPIB. C. 18F-fluoride. D. 11-ciracopride. Answer. Correct answer. B. 11-CPIB. Explanation. 11-CPIB Pittsburgh compound B is a radiolabeled tracer specifically used in PET imaging to assess amyloid plaque deposition in the brain, a hallmark of Alzheimer's disease. While 18F-FDG is useful for evaluating glucose metabolism, it does not specifically target amyloid plaques. 18 nefluoride is primarily used in bone imaging, and 11 C-racapra targets dopamine receptors, not amyloid plaques. Question 10. Which of the following is a critical factor when determining the optimal radionuclide for PET imaging in a clinical setting? A. The half-life of the radionuclide. B. The cost of the radionuclide. C. The photon energy of the emitted radiation. D. The molecular weight of the radiopharmaceutical. Answer. Correct answer. A. The half-life of the radionuclide. Explanation. The half-life of the radionuclide is a critical factor in PET imaging as it determines how long the radiopharmaceutical remains active and available for imaging. A short half-life is ideal for minimizing patient radiation exposure while providing adequate time for imaging. The other factors, such as cost, photon energy, and molecular weight, also play a role, but the half-life is the most crucial consideration for ensuring effective and efficient clinical imaging. Question 11. Given the circumstances where Mr. Thompson is conducting a PET scan to assess brain metabolism in a patient with suspected Alzheimer's disease, what is the most likely tracer you will use to evaluate amyloid deposition? A. 18-FDG. B. 11-PIB. C. 18-fluoride. D. 68-gidotate. Answer. Correct answer. B. 11-PIB. Explanation. In Alzheimer's disease imaging, 11-PIB Pittsburgh compound B is a PET tracer used to detect amyloid plaques, which are a key marker of Alzheimer's pathology, while 18-FDG Oxygenate is commonly used to assess glucose metabolism. It does not directly visualize amyloid deposition. 18-fluoride, option C, is used for bone imaging, and 68-gidotate, option D, is used in imaging neuroendocrine tumors. Therefore, the most appropriate choice for assessing amyloid deposits in the brain is 11-PIB. Question 12. Which of the following statements best describes the significance of time-of-flight (TOF) PET in improving image quality? A. TOF PET improves spatial resolution by reducing the amount of scatter in the data. B. TOF PET reduces the noise in the images by increasing the coincidence detection time window. C. TOF PET improves the signal-to-noise ratio by using time difference to localize the annihilation event. D. TOF PET improves the accuracy of attenuation correction in the final image reconstruction. Answer. Correct answer. C. TOF PET improves the signal-to-noise ratio by using time difference to localize the annihilation event. Explanation. Time-of-flight (TOF) PET utilizes the time difference between the detection of two photons resulting from positron annihilation to more accurately determine the location of the annihilation event. This results in improved signal-to-noise ratio and better image quality. TOF PET does not directly reduce scatter or noise through coincidence detection time, option B. Attenuation correction, option D, is independent of TOF and uses a separate process. Question 13. In the context of hybrid imaging, what is the main advantage of combining PET with MRI over PET? A. MRI provides better attenuation correction than ET. B. MRI provides better soft tissue contrast, which is critical for accurate tumor delineation. C. MRI is faster than CT, thus reducing patient exposure to radiation. D. MRI provides better detection of bone metastasis compared to C. Answer. Correct answer. B. MRI provides better soft tissue contrast, which is critical for accurate tumor delineation. Explanation. Hybrid PET-RE systems provide superior soft tissue contrast compared to PET, which is essential for accurate tumor delineation, especially in areas like the brain, prostate, and soft tissues. While MRIs offer some advantages in terms of attenuation correction, option A, its primary benefit lies in its high tissue resolution. PET is better suited for bone imaging, option D. MRI does not necessarily reduce patient exposure to radiation more than CT, option C. Question 14. Which of the following would be an appropriate method for correcting scatter in PET imaging? A. Using a higher energy window to capture more photons. B. Applying an empirical scatter correction algorithm in image reconstruction. C. Reducing the field of view to minimize scatter. D. Increasing the number of coincidence events to decrease scatter influence. Answer. Correct answer. B. Applying an empirical scatter correction algorithm in image reconstruction. Explanation: scatter correction in PET imaging is typically done during the image reconstruction process using empirical algorithms that estimate and subtract scattered photons from the data. Increasing the energy window, option A, would not correct scatter, but could instead introduce more noise. Reducing the field of view, option C, would limit the data collected but directly address scatter. Increasing the number of coincidence events, option D, helps with signal to noise but doesn't directly correct for scatter. Question 15. In terms of radiochemistry for PET, which of the following radionuclides is most commonly used for the production of the tracer 18-ADG? A. Cyclotron-produced 18th. B. Generator-produced 68Ga. C. Cyclotron-produced 11G. D. Generator-produced 99G. Answer. Correct answer: a cyclotron produced 18th. Explanation: 18th, the radionuclide used in 18-ADG, is typically produced in a cyclotron through the bombardment of a target material with protons. 68Ga, option B, is used for different tracers like 68Ga dotatate, while 11G, option C, is used for tracers like 11G-methionine. 99G, option D, is commonly used in SPECT, not PET imaging. Question 16. From a technical perspective, which of the following factors would most influence the spatial resolution of a PET scanner? A. The size of the crystal detectors. B. The amount of radioactive tracer injected. C. The total energy deposited in the scintillator. D. The field of view used for the scan. Answer. Correct answer: A. The size of the crystal detectors. Explanation: spatial resolution in PET imaging is heavily influenced by the size of the crystal detectors used in the scanner. Smaller crystals provide higher resolution by more precisely localizing the position of the annihilation event, while the radioactive tracer, option B, impacts image quality. It does not directly influence spatial resolution. The total energy deposited in the scintillator, option affects signal intensity, but not spatial resolution. The field of view, option D, affects coverage but not resolution. Question 17. When analyzing PET images, which of the following best describes the purpose of attenuation correction? A. It compensates for the loss of photons due to absorption by the body. B. It improves the signal-to-noise ratio by reducing the effects of scatter. C. It increases the contrast of the images by enhancing the signal from the radio tracer. D. It removes noise from the final reconstructed image. Answer. Correct answer: A. It compensates for the loss of photons due to absorption by the body. Explanation: attenuation correction in PET imaging compensates for the reduction in photon counts as they are absorbed or scattered by tissues between the detector and the radio tracer. This correction helps to produce accurate images by accounting for the varying tissue densities that affect photon transmission, while scatter correction improves image quality. Option B, attenuation correction specifically compensates for absorption. Option A. Question 18. Which of the following is a primary challenge in the clinical application of PET imaging for monitoring cancer treatment response? A. Limited availability of radiopharmaceuticals. B. Inaccurate tumor delineation due to motion artifacts. C. Poor spatial resolution leading to misinterpretation of small lesions. D. High patient radiation exposure during PET scans. Answer. Correct answer: B. Inaccurate tumor delineation due to motion artifacts. Explanation: a significant challenge in PET imaging for cancer treatment monitoring is the potential for motion artifacts, particularly due to patient movement, breathing, or even bowel motion. These artifacts can blur tumor boundaries, making accurate delineation difficult, while limited availability of radiopharmaceuticals, option A, and radiation exposure, D, are concerns. They are less critical in comparison to the issue of motion artifacts. Poor spatial resolution, option C, is less of an issue with modern PET scanners. Question 19. What is the primary benefit of using PET fusion imaging in oncology? A. PET fusion imaging increases the accuracy of identifying metastases. B. PET fusion imaging decreases the radiation dose to the patient. C. PET fusion imaging provides better soft tissue resolution than PET-RE. D. PET fusion imaging eliminates the need for biopsy in diagnosing cancers. Answer. Correct answer A. PET fusion imaging increases the accuracy of identifying metastases. Explanation: PET fusion imaging provides the advantage of combining metabolic and anatomic information. PET detects the functional changes associated with cancer metabolism, while CT provides detailed anatomical imaging. The fusion of these modalities enhances the ability to accurately locate and assess metastases. It does not reduce radiation. Option B, nor offer better soft tissue resolution than PET-RE. Option C, and it does not eliminate the need for biopsy. Option D. Question 20. In PET imaging, what is the key reason why the standardized uptake value, SUV, is commonly used? A. It provides a direct measure of tumor aggressiveness. B. It normalizes the radiotracer uptake relative to body weight, allowing comparison across patients. C. It accounts for the patient's metabolic rate during the scan. D. It quantifies the total dose of radiation delivered during the procedure. Answer. Correct answer. B. It normalizes the radiotracer uptake relative to body weight, allowing comparison across patients. Explanation: the standardized uptake value, SUV, is used to quantify radiotracer uptake in tissues, normalizing the value relative to the patient's body weight and injected radiotracer dose. This allows for comparison of radiotracer uptake across patients and different time points, while SUV can provide inter-tumor activity. Option A, it is not direct measure of aggressiveness. It does not account for metabolic rate. Option C, or radiation dose. Option D. Question 21. Which of the following is the main advantage of using the 18FDG PET scan in assessing brain activity? A. It provides a detailed anatomical map of the brain. B. It measures glucose metabolism to evaluate brain function. C. It detects amyloid plaques in neurodegenerative diseases. D. It can assess brain blood flow in real time. Answer. Correct answer. B. It measures glucose metabolism to evaluate brain function. Explanation: 18F PET is primarily used to assess glucose metabolism, which is closely linked to brain activity. This allows for the evaluation of brain function, especially in conditions like epilepsy, dementia, and tumors. While it provides some anatomical information, it is not used for detailed structural imaging. Option A. It does not detect amyloid plaques. Option C, or directly assess blood flow. Option D. Question 22. In PET imaging, what is the role of the positron emitted during the radiotracer decay process? A. It provides a signal that is captured by external detectors. B. It interacts with electrons to create gamma rays. C. It is absorbed by tissues and enhances image contrast. D. It produces heat, which is measured for imaging. Answer. Correct answer. B. It interacts with electrons to create gamma rays. Explanation: the positron emitted during radiotracer decay interacts with an electron in the body, resulting in annihilation and the creation of two gamma rays. These gamma rays travel in opposite directions, and their detection by PET scanners helps to create an image of the radiotracer distribution. The positron does not directly provide an external signal. Option A, no. It produces heat. Option D, or enhance contrast. Option C. Question 23. What is the primary challenge in using PET to evaluate tumors in patients with a high body mass index BMI? A. Increased radiation exposure due to the thicker body tissues. B. Difficulty in obtaining accurate images due to the lower sensitivity of the scanner. C. Reduced ability to detect small tumors because of increased body fat. D. Reduced signal from the radiotracer due to low metabolism in obese tissues. Answer. Correct answer. C. Reduced ability to detect small tumors because of increased body fat. Explanation: high body fat can affect the sensitivity of PET scans, particularly when detecting small tumors, as fatty tissue can reduce the ability of the scanner to accurately detect the radiotracer's location. Increased BMI does not directly increase radiation exposure. Option A, nor does it significantly reduce sensitivity. Option B, or the signal from radiotracer itself. Option D. Question 24. Which of the following imaging modalities is most commonly paired with PET to assess tumor metabolism and anatomical location? A. Ultrasound. B. MRI, ECT. D. X-ray. Answer. Correct answer, ECT. Explanation: CT is most commonly paired with PET in hybrid PET scanners. This combination allows for both functional imaging from PET and detailed anatomical information from a MRI. Option B is also used in some cases, but CT remains the standard for combining anatomical and functional data. Ultrasound option A and X-ray option D are not typically used in combination with PET for this purpose. Question 25. Which of the following is the primary advantage of using PETMRI compared to PET in oncology? A. PETMRI provides higher radiation doses to patients, improving image quality. B. PETMRI is less effective in detecting tumors located in the chest. C. PETMRI offers better soft tissue contrast without the use of ionizing radiation. D. PETMRI is more widely available and less expensive than PET. Answer. Correct answer. C. PETMRI offers better soft tissue contrast without the use of ionizing radiation. Explanation. PETMRI is advantageous in oncology because MRI provides superior soft tissue contrast, which is especially important for imaging brain, liver, and soft tissue tumors. It also avoids the ionizing radiation associated with CT scans. PETMRI is not more widely available or less expensive. Option D, nor is it effective in detecting chest tumors. Option B. The radiation dose in PETMRI is lower due to the absence of C. Question 26. Which radiopharmaceutical is commonly used for imaging in patients with Parkinson's disease or other movement disorders? A. 18-FG. B. 18-fluorodopa F-dopa. C. 68-gadotate. D. 11-methionine. Answer. Correct answer. B. 18-fluorodopa F-dopa. Explanation. 18-fluorodopa F-dopa is commonly used in PET imaging for movement disorders like Parkinson's disease as it targets dopaminergic activity in the brain. 18-FG, option A, is used for metabolic imaging but is not specific to Parkinson's disease. 68-gadotate, option C, is used for imaging neuroendocrine tumors, and 11-methionine, option D, is used in cancer imaging. Question 27. What is the typical decay mode of a radionuclide used in PET imaging? A. Alpha decay. B. Beta plus decay, positron emission. C. Gamma decay. D. Neutron emission. Answer. Correct answer. B. Beta plus decay, positron emission. Explanation. Radionuclides used in PET imaging typically undergo beta plus decay, positron emission, where the nucleus emits a positron that interacts with an electron, resulting in gamma ray production. Alpha decay, option A, is not common in PET radionuclides. Gamma decay, option C, occurs in some other radiological processes, but not typically in PET. Neutron emission, option D, is not associated with PET imaging. Question 20. Which of the following is a limitation of PET imaging in the evaluation of small lesions? A. High sensitivity to motion artifacts. B. Insufficient contrast between tumor tissue and surrounding structures. C. Inability to detect high-grade tumors. D. Inability to assess functional activity of tumors. Answer. Correct answer. A. High sensitivity to motion artifacts. Explanation. PET imaging is highly sensitive to motion artifacts, particularly when evaluating small lesions. Patient movement, including breathing or involuntary muscle movement, can blur the image and reduce accuracy, while PET provides functional information, option D, and is effective in detecting high-grade tumors, option C. Motion artifacts are the main limitation for small lesions. PET can often distinguish tumors from surrounding tissue, option B. Question 29. Which of the following is the primary reason that PET scans are typically not used for imaging bone metastases? A. PET scans do not have sufficient resolution to detect bone lesions. B. Bone tissue does not accumulate enough radiotracer for PET imaging. C. Bone metastases do not show up on PET scans due to lack of metabolic activity. D. PET scanning is ineffective in imaging calcified tissues like bone. Answer. Correct answer. B. Bone tissue does not accumulate enough radiotracer for PET imaging. Explanation. Bone tissue does not typically accumulate sufficient amounts of radiotracer for effective visualization on PET scans, making it less suitable for detecting bone metastases. PET scans excel in detecting metabolically active tissues like tumors, but are not ideal for imaging bone, option A. Bone metastases can be detected with other modalities like bone scans or CT. PET is effective for soft tissue tumors, option C, and calcified tissues are less problematic, option D. Question 30. Which of the following statements best describes the advantage of using PET in combination with CT for cardiac imaging? A. PET allows for the assessment of both myocardial perfusion and metabolic function. B. PET provides better resolution of cardiac chamber size compared to MRI. C. PET is preferred for assessing coronary artery calcification. D. PET is effective in monitoring heart rate and rhythm abnormalities. Answer. Correct answer A. PET allows for the assessment of both myocardial perfusion and metabolic function. Explanation. PET in cardiac imaging is used primarily to assess both myocardial perfusion, blood flow, and metabolic function, which are crucial in evaluating coronary artery disease and heart function. MRI option B provides better resolution of soft tissue but is not as commonly paired with CT for this purpose. PET is not used for coronary artery calcification assessment, option C, or for monitoring heart rate and rhythm, option D.